My name is Marciana Popescu, and I'm an associate professor at Fordham University in New York City and an avid advocate for women's rights. When thinking of gender equality, one important starting point is to unpack the layers of inequality and implicitly the engines of marginalization that pushed women, girls, LGBTQ communities to the margins historically, limiting their access to resources, visibility, and representation. We are now dealing with a global pandemic, a global public health crisis that some might think would be a great equalizer because viruses do not discriminate, right? Except when structures that we created and supported are already setting some people at high risk. So what would be the most significant impact of this pandemic on women migrants? As migrant women represent approximately 74% of the service industry, according to the IOM's World Migration Report, and over half of people currently on the move due to forced migration, according to UNHCR reports, women numerically, they already are the most affected. IOM's report summarizes main challenges during this pandemic for women migrants under 5 major categories: job insecurity and exploitation with major economic losses, stigmatization and increased xenophobia and marginalization, high risk to get infected, overload of care work by being the de facto caregivers and in many instances the sole breadwinners. Migrant women's exposure to the virus is significantly higher. And I would pause here to also say that this comes with greater impact on their mental health, torn between their perceived and assumed responsibilities and their own survival needs. Migrant women are experiencing heightened stress and anxiety, often building on compounded past losses, present exhaustion and lack of resources, and the fear of future loss of life among the ones they love most. And finally, increased gender-based violence. It's very interesting to think of some of the protection mechanisms put in place during this pandemic, such as sheltering in place. Sheltering in place policies assume that all people have a place that is safe and secure. Shelter in place for many women on the move only mean sheltering in a refugee or IDP camp, transitional housing unit or detention center, places that do not provide any levels of safety and further expose women to the pandemic. For others, the place they are asked to shelter in is a place of violence, trafficking, and abuse. If we think of the United States, for women in the United States that are already dealing with the complexities of a dysfunctional and discriminatory immigration process and the loss of family members, community, and networks of support due to forced migration, the pandemic created multiple additional issues. It cut accesses to legal processes, increasing the state of uncertainty. Will they be allowed to continue asylum processes? Could they be removed or repatriated based on new public health policy in the US that is actually a gateway to ending asylum processes indefinitely? What will happen with children if they are deported, or if they lose their jobs and cannot provide for them anymore, or if they get sick, and so on and so forth? It created major economic problems, and this is a global issue, but it really affected women in the United States drastically, because now they either lose their jobs or they continue to work being further exposed. Parenting comes with an added challenge of remote education, which, is really affected by language barriers and the technology divide. And of course, access to health and mental health care in a country that does not define healthcare as a right is even more problematic during these times. So what can be done to address these issues and provide equal protection during a pandemic that is affecting us all to women migrants? I'd say the most important element in times of high uncertainty should be rethinking availability and access of services, creating safety within a complex emergency context. Yes, by providing information, accurate information, by making sure that women feel safe, whatever services they need to use, and by making sure that we create such services. The IOM report also provides several policy recommendations that I built on to create an action plan. Redefine safety. Of course, I started with that, engaging with women to guide the planning and design of safe spaces. Ensure access to safe facilities. According to UNDP, safe facilities, especially at borders, can help reduce the risk of contagion and situations of sexual and gender-based violence. Yet current situation at the southern border is contrary to following any such standards. Provide economic safety net for all, including women migrants, through policies that facilitate their access to economic benefits, regardless of their immigration status. Provide protection equipment against COVID-19 in all migrant assistance centers. ensure access to care services without discrimination, and facilitate access to remote services, because this becomes so important during this pandemic. I will be amiss not to end by saying that we need to stop and learn from the amazing resilience of women migrants, yet not use this resilience to justify our apathy or the continuous marginalization and increased invisibility of this population. Use it as capacity that we can work with the women to continue to build on, and hold governments accountable to provide equal protection and support for women and girls on the move during any such complex emergencies, because it is their right. And because if we deny other people's rights, we are, as Paulo Freire aptly said it so long ago, dehumanizing ourselves. Thank you.
Today we'll be talking about climate change and its disproportionate impact on women's health. Climate change is one of the defining issues of our time, and it's particularly relevant to the medical profession due to its significant impact upon health. Climate change affects health through a multitude of mechanisms, such as reducing air and water quality, increasing heat exposure, increasing the frequency of extreme weather events, altering transmission patterns of vector-borne diseases, and decreasing food security. These impacts affect women disproportionately, as noted by the United Nations Framework Convention on Climate Change, which recognizes that women, especially those in poverty, face higher risks and experience a greater burden of impact from climate change. As a result, climate change is a risk multiplier that threatens to widen existing gender-based health disparities.
The disproportionate effect of climate change upon women's health is multifactorial, being mediated through socioeconomic, physiological, and cultural vulnerabilities, which differ substantially between men and women. Firstly, the health impacts of climate change are experienced most intensely by those in low to middle income countries, especially those in poverty, 70% of whom are females, totaling almost 1 billion women globally at high risk. The distinct physiology and health needs of women, such as increased nutritional demands during pregnancy and menstruation, and higher baseline levels of anemia and malnutrition globally, places them at risk of suffering from climate-sensitive diseases and food shortage related to food insecurity. Further, many cultural practices involving women worsen the health impacts of climate change, including poorer access to healthcare, lower educational levels, as well as culturally prescribed clothing and household roles of cooking and water provision.
It is important to note that climate change not only introduces new health challenges, but also exacerbates existing ones. Exposure to poor air quality, which often leads to secondary respiratory and cardiovascular disease, has been shown to preferentially affect women. This is mainly due to a greater deposition of particulate matter in the lung tissue of women. Poor air quality has also been associated with negative birth outcomes, such as stillbirth, intrauterine growth restrictions, and congenital defects. In addition to poor air quality, women are much more sensitive to climate-driven food insecurities. With increased nutritional needs during menstruation and pregnancy, women are at high risk of anemia and malnutrition, which in turn can lead to cognitive impairments, diminished working memory, and poor educational outcomes. Studies have also shown that during climate change-related disasters, women suffer disproportionate mortality, and survivors experience significant decrease in life expectancy in comparison to men. It is also important to highlight the effects of climate change-driven migration and displacement on women's health. Psychological stress is often heightened after disasters, and there is widespread consensus that women and girls are at higher risk of sexual violence, sexual exploitation and abuse, trafficking, and domestic violence during these times. The consequences of such violence on the health and well-being of these women are significant and numerous. Unfortunately, due to time constraints, we have only managed to provide a brief snapshot of the many impacts of climate change on the health of women, and we definitely encourage you all to look further into the issue.
Climate change and gender inequality are increasingly recognised as global problems requiring integration of a gendered perspective into existing climate, development and disaster risk reduction policies. Some progress has been made from the World Health Organization, United Nations Framework Convention on Climate Change, and the Sustainable Development Goals. However, data collection, monitoring of gender-specific targets, and intersectoral coordination must be prioritised. Interventions addressing the largely modifiable socioeconomic, physiological, and cultural factors which mediate climate-related health impacts present climate-resilient health solutions and include improving water quality, sanitation, food security, as well as reducing malnutrition and encouraging climate-resilient farming. Finally, women must be empowered as educators, agents of social change, and most importantly, key stakeholders and problem solvers in their battle against the health impacts of climate change.
Good morning, everyone. My name is Nikki Raftopoulos, and I will be speaking with Stacia De Silva and Anita Scaros on the gendered impact of COVID-19, a look at the effects on young girls, carers and migrants. I'm currently studying medicine at the University of Notre Dame, and I feel humbled to speak at this event while we all share a passion for the rights of women. So I will be speaking specifically on the impact of COVID-19 on young girls. Substantial evidence shows outbreaks and crises compound existing inequalities and disproportionately affect young girls, mostly by the secondary impacts of the outbreak due to harmful social norms and double discrimination based on age and gender. So, in emergencies, the most vulnerable suffer the most, and so therefore it's important to consider the impact of COVID on education and on sexual and reproductive health. So firstly, onto education. COVID-19 has and will continue to disrupt early learning, formal education and livelihoods. Girls, their families and communities face extreme stress from health and economic burdens, crowding and isolation. Measures to curb the disease have worsened existing inequalities, forcing 743 million girls out of school, placing them at a heightened risk of domestic violence in their home. And also to note is that boys are more likely to own a smartphone and therefore have access to the internet, exacerbating further gender gaps in education. Furthermore, school closures have led to increased dropout rates before they complete their education, especially those living in poverty. Even before the pandemic, girls were not on course to meet minimum proficiency in basic reading and maths, which are the knowledge and opportunities they need for a productive and fulfilling life. And evidence from past epidemics show that girls are at a particular risk of dropping out and not returning to school after the crisis. Secondly, sexual and reproductive health. So when girls are out of school, they struggle to access social support structures and essential services. We have seen a global increase in domestic violence that has been described as the second pandemic. Economic downturns, job losses, and social closures will increase sexual violence, exploitation, trafficking, child labour, and harmful practices. Thank you.
Thanks, Nikki. So my name's Anita and I'll be talking about the impact of COVID on women as carers primarily. So during times of pandemic or health crises, we do kind of see the cracks start to show and the gender inequalities really come to the surface. So there are two real ways in which COVID-19 has affected women as carers. One, the first is through paid work, as women make up majority of the healthcare frontline, and the second is through unpaid work, so caring for sick family members and also caring for school children who are now at home. So firstly, women in the frontline of the health workforce. So globally, about 70% of the health workforce is female. Interestingly, when we talk about the frontline, we're talking about nurses, janitors, laundry cleaners, but unfortunately that doesn't translate to the leadership healthcare aspect, where only 20% of females are in that workforce. So in Australia, about 75% of healthcare professionals are women, and women make up 88.5% of the nursing and midwifery cohort, and that really reflects the 85% globally. So what effect does this have? So it leads to an increased exposure and spread of the virus to their family members. And globally, we do see this as infection rates are higher in female healthcare workers, which has been seen in both Spain and Italy. Now, the second prong to this is the effect on unpaid carers. So during the COVID-19 pandemic, in 191 countries, they implemented a nationwide school closure. Women spend more time caring for sick family members and also educating children that are now at home. And as Nikki mentioned earlier, temporary school closures have led to school dropout. And in low and middle income countries, this has led to women getting forced to get married younger and support their families or not be a burden on their family. So this really affects the double caregiving burden for paid care workers. So women who are in the frontline healthcare workforce and also looking after family members at home. So the additional demands that this places on them means that they require longer working hours, and the increased risk that they place as well on their family members. And paid care workers are also at a higher risk of infection. So I'll pass over to Saisha.
Thanks, Anita. So thank you for having me talk today. I will be talking about the impact of COVID-19 on migrant women. This is a particularly vulnerable group of women as they face inequalities from the intersection of their minority status as migrants and as women. So it is known that women make up 50% of the estimated 272 million migrants who live and work outside of their home countries. Of these, 66.6 are also migrant workers and comprise a large part of the global service industry. As Anita mentioned, they also are disproportionately represented in the amount of unpaid work that they perform. Loss of livelihood. So COVID-19 has led to an economic downturn, which has seen the termination of employment for many individuals. Migrant women are particularly at risk of this as they are overrepresented in the informal economy. This means that they're vulnerable to the termination of employment, and the compromised visa status and lack of workers' authorisation leaves them vulnerable to a lack of social support and isolation. It is known that remittances sent back to the migrants' home countries form a crucial part of the local economy and are used to meet basic healthcare and education needs. Unavailability of transfer services, as well as a reduction in incomes, could lead to a widespread devastation of local economies in the wake of COVID-19. Social isolation, a greater risk of domestic violence, and human rights violations are all things that can impact migrant workers and migrant women, particularly during healthcare crises. This has particularly been seen in past epidemics, and emerging evidence shows that it is becoming an issue during this COVID-19 pandemic as well. Exclusion from social safety nets due to lack of permanent resident status leads to a lack of access to healthcare insurance schemes and medical treatment. In this COVID-19 pandemic, this means that high-risk women are less likely to seek treatment for medical emergencies and less likely to get tested and treated for COVID-19, placing them at greater risk, them and their communities at greater risk of disease complications. Marginalised ethnicities and genders are more vulnerable to sexual abuse at all times. This is particularly exacerbated during times of pandemic, and it is known that the most marginalised ethnicities are the ones to normally underreport. Instances of human trafficking, sexual abuse and domestic violence all increase during times of health crises. So that brings us to the end of our talk. Thank you for having us speak today.
Hi there, my name is Madison Riley.
And my name is Grace Sutherland.
And today we'll be talking about the shadow pandemic, COVID-19 and domestic violence.
As the global COVID-19 pandemic sweeps across the globe, killing millions worldwide and devastating global economies, so too do the rates of domestic violence. In a pandemic known as the shadow pandemic, women around the world in all levels of society are experiencing unprecedented levels of abuse. 1 in 3 women experience physical and sexual violence at some point in their lives. In the week since COVID-19 restrictions, reported cases of violence against women have surged. According to the United Nations, cases of domestic violence in France have increased by 30% since lockdown, and in Argentina, emergency calls for domestic violence have increased by 25% since March 20. Google has reported a 75% spike in searches for help with domestic violence. Here in New South Wales, there has been an 11% increase in referrals through the government's Safer Pathways program.
Historically, rates of domestic violence have spiked in the face of worldwide crises. For instance, following Hurricane Katrina in 2005, the USA saw a 4-fold increase in domestic violence cases. This reflects the tendency of perpetrators to escalate violent behaviours in the face of a disaster, as we are currently seeing with this COVID-19 shadow pandemic. In order to combat this unprecedented rise in violence against women, we first must understand the unique factors that the COVID-19 pandemic poses with regard to protecting and monitoring victims of domestic violence. Foremost, lockdown restrictions have confined women to their homes, which, as we know, is the major context in which human rights violations commonly take place. Not only do lockdown restrictions trap women with violent and abusive partners, but they also create an environment whereby abuse can go unrecognised and coercive behaviours can be escalated. In addition to this, the COVID-19 restrictions significantly limit the array of both services and social supports that women would have otherwise had access to. For instance, women are less likely to come in contact with medical professionals, co-workers, friends or family members who they would normally disclose acts of violence to. Whilst essential services such as domestic violence shelters are technically still open, they too are limited in the number of women and children whom they can accommodate. Undoubtedly, pre-existing violent family dynamics have been further inflamed by the health and financial stressors that COVID-19 has placed on households. As job losses reach 20.5 million in the USA, alcohol sales steadily rise and people genuinely fear for their health and well-being, women are absolutely placed in increased risk of experiencing violence in the household.
The United Nations has issued a call to action to highlight and manage the surge of domestic violence associated with COVID-19. Governments need to ensure that domestic violence services be considered essential during the pandemic. So far, Australia has committed $150 million of extra support to victims of domestic violence, aiming to ensure that victims have safe accommodation. Additional stimulus packages for these services is necessary in a global capacity. Recently, the United Nations released the Shadow Pandemic Public Awareness Campaign to shine a light on the current domestic violence crisis. The film urges people to recognise and support women who are suffering. Given the current social restrictions, boosting online support and counselling services is necessary. However, additional measures need to be made for women who do not have access to the internet. Additionally, the police force must be educated regarding the gravity of the situation to ensure that violence against women will never be tolerated and perpetrators will be held accountable.
The shadow pandemic is a global emergency which reflects the deeply ingrained oppression of women in contemporary society. Through increased funding, public education, online support systems and involvement of the police force, we can work together to combat violence against women both during the COVID-19 pandemic and in the future.